Hi everybody, Dr. Ed Gigliotti here. One thing that gets us excited in the office is caring for families, and it all comes down to anatomy. A lot of times when people come in under care, there's like one or two family members that are like, we want to start care because we're having these symptoms, right? Soon after, it's quite common that many times the whole family ends up becoming chiropractic patients. And it comes down to basic anatomy. So we all understand that organ function is important. Like we, throughout our lives, will get our heart checked, right? Check our blood levels, check all blood testing to make sure our liver and kidney function is good, and so on and so forth as years go on. The most important organ we have is our spinal cord, our brainstem and our spinal cord, the central nervous system. You have the brain that's inside the skull, right? And the brainstem comes down to about the atlas level. The atlases are right there. So the bottom of the brainstem, the lowest part of your brain, where it's all funneling through, is called the medulla oblongata, okay? And the atlas is there, and C2 is here. So old school chiropractors, one term they used to use is they would call a subluxation where bones twisted out of place, putting pressure on the neurology, right, affecting function. They would call that the silent killer. And the reason why they said that is because when you have pressure on the central nervous system, it literally degrades function, and you get dysfunction throughout the whole system. So as time's going on, from a health and from a physiological standpoint, you're going down a pathway you don't want to. So the way that they would describe it with some of their patients, like some upper cervical docs, they'd be like, in a way, it's like the silent killer, because like when you have these misalignments, if you don't know to get checked and you're not having symptoms, or you're having symptoms and you don't know that there could be pressure there, your whole body's going down a pathway you don't want to. Now, in the office here, we phrase it a little bit differently. We say it's all about the expression of life and about going the way you want to. So we're just looking at it from a different angle, but same premise. That brainstem and that spinal cord control everything. And whenever there's pressure on it, your body is now going down a pathway you might not want it to, because it's not functioning the way you're designed. And just bring it to an extreme. Think about if somebody's ever had a severe spinal cord injury. Look at their quality of life afterwards. What happens to their organ function, their mind frame, their mood, all their health, their immune function, everything, right? So when you have a lesser injury that's still quite significant and it's being overlooked, it can affect every facet of your life, from mood, sleeping, right? Insomnia, we say high correlation with that. High blood pressure, right? We see stuff with thyroid function, which is huge neurological. And it's all neurological on how that thyroid's functioning, right, in the middle of your neck. Pain, migraines, headaches. Now think about how these situations would affect someone's quality of life and how that would affect the dynamics of a family, right? Like, how many of you out there might be listening to this and have a family member who's struggling with pretty significant health issues or day-to-day function, or they're just miserable every day, and you think it might be related to how they're feeling, like with migraines, headaches, or neck pain, or whatever. And how is that affecting the relationship in the family? How is that affecting how someone can be a parent, how somebody can be a grandparent, how siblings get along, how a child's doing in school? This is why we're so passionate about getting families under specific and scientific chiropractic care. My family's all under care. And, you know, if, let's say, we end up anywhere in the world, our number one priority would always be, like, let's make sure we're all clear. So luckily, I would be able to clear my whole family, but I would be getting an upper cervical chiropractor, like, right away. Because when you understand how the body functions, you can never look at it the other way. So guys, share the message. Find a chiropractor near you. Get your families under care. In our office, we make it affordable. We have family plans for that reason, because we have big families that are under care, even like as much of 8 to 10 family members, like all under care from the same family. And it's like, that's what gets us excited, because that's how you literally can transform not only yourself, but the whole dynamics of your immediate and extended family and how they're doing in the world too. We love and appreciate you. Thank you for spending a few moments with me. Share this message, please. People need to know. It's not about just waiting till you fall apart when your symptoms get bad enough. By the time that happens, a lot of times there's already injury and damage that has occurred to the tissues. It's about finding where there's misalignment, where there's pressure on that brainstem and that spinal cord, and very gently getting that off so you can transform your whole future. Thank you.